Acne, a problem you hoped you left behind a long time ago, but now it's back. Breakouts in your later years, another issue now added to your already existing list of concerns. So why are you getting acne in this phase of your life? Of course you rationalize it's hormonal, but will it fade out with time like before? Or is the acne this time here to stay? Now, before you press the panic button, let us understand why this is common in perimenopause. Watch this video to find out how your hormones may be driving it and what you can do to get that acne-free skin back. Assalamu alaikum and welcome to my channel. If you are new here, my name is Dr. Nikita Islam. I'm a gynecologist turned perimenopause health coach. I'm also a revered Muslimah and a mother to 3 wonderful children, alhamdulillah. I help Muslim women navigate through perimenopause and menopause with more focus, energy and confidence by following holistic wellness practices that are safe and effective, easy to follow and aligned to our deen. If you are interested in knowing more about perimenopause and menopause, I invite you to attend my free workshop, Hormonal, where I talk extensively about menopause and perimenopause and all the different changes that happens in your body during this time. Alhamdulillah, I have been blessed with acne-free skin, and even in my teenage years, I only had the occasional spots. I do have very dry skin, and that might be the reason that I was never plagued with acne, much to the surprise of my school friends who were forever looking for acne remedies and ways to prevent scarring. Fast forward to my late 40s, I noticed that my very dry skin was suddenly shiny and oily, and I started getting acne, especially premenstrually. I will be honest, I had mixed feelings about it. I thought to myself, I'm sure I still have my youthful hormones. However, it was quite embarrassing getting all these spots, and I had to keep covering them with my scarf because I didn't actually want people to notice it and ask me how come I was getting acne at this age. To make it worse, my daughter was a teenager at that time and would often wonder how her mum had suddenly started getting acne. It turns out that acne is not that uncommon in perimenopause. Around 25% of women between the ages of 40 to 49 can experience acne. So let's explore what are the hormonal changes that is responsible for perimenopause acne. There are 3 main hormonal changes responsible for acne as we get older. Testosterone levels are likely to rise, resulting in slow cell turnover and cystic acne. Progesterone declines, leading to inflammation because progesterone is naturally anti-inflammatory. And thanks to low estrogen, you may notice that you scar more easily from spots. Plus, the reduced collagen and elastin also means that pores become more larger and prominent. So have you noticed this if you are getting acne in this age? During menopause, you may also be battling with sleep issues, sugar cravings, stress and mood changes, all of which can exacerbate problematic skin. Your skin will produce more oil and sebum. The rate at which old skin cells are shed decreases. Your pores can get blocked by these old skin cells and become inflamed, resulting in breakouts. So where do you get hormonal acne? Hormonal acne tends to appear on the lower part of your face, including the bottom of the cheeks and the jawline. But it may also affect the back, the chest and shoulders. Hormonal acne tends to take the form of painful cystic bumps under the skin, but it can also form painful red papules or pustules on the surface. Hormonal acne often reappears in the same area due to oil production patterns. So if you're noticing a breakout continuously reappearing in the same area, it's likely to be hormonal. The good news is that in most cases, You don't need to take medications or completely revamp your skincare or take any drastic measures to get better looking acne-free skin in perimenopause. Simple changes in diet and lifestyle and a simple skincare routine is the first thing you should consider before you head to your GP or your dermatologist. So what can you do to have acne-free skin in perimenopause and menopause? Remember, it's an inside-out approach. We tend to focus a lot on skincare and what we can apply on the skin, but the fact of the matter is that good skin health starts from within. Keep yourself hydrated. Have an anti-inflammatory diet. Think of fresh fruits and vegetables, turmeric, ginger, green tea. Avoid dairy. In many cases, going dairy-free for 3 weeks is going to be all that you need. Reduce sugars and simple carbohydrates. Omega-3 fatty acids are great because they reduce excess sebum and bacteria, and they also help balance acne-causing hormones such as testosterone and other androgens. There is a reason why it's called beauty sleep. Good and sufficient sleep and quality sleep equals good skin health and balanced hormones. Have a simple skincare routine. Try oil cleansing, and yes, oil can actually help with acne. You could mix castor oil with coconut oil or olive oil, about 1 part of castor oil to 2 parts of your carrier oil. Massage it gently into your face for about a minute, and then use a warm, damp cloth to wipe it off. So why does this work? Castor oil is anti-inflammatory and helps dissolve clogged pores. Coconut oil is antibacterial and moisturizing. This removes makeup and dirt without stripping your skin. Try a tea tree oil spot treatment. Tea tree oil is great for topical treatment of spots. You should always dilute tea tree oil with a carrier oil before use. So popular carrier oils would include coconut oil, jojoba oil, or olive oil. The general rule is to add about 12 drops of carrier oil to every 1 to 2 drops of any essential oil. Tea tree oil is available in many of skincare products such as cleansers and toners. You can also use tea tree essential oil just as a spot treatment. However, it is important to do a skin patch test before using diluted tea tree essential oil. To do this, apply the diluted oil to the inside of the forearm. If you don't experience any irritation or inflammation within 24 hours, it should be safe to apply elsewhere. Tea tree is naturally antibacterial and anti-inflammatory, perfect for those stubborn hormonal spots. Twice a week, treat your skin to a gram flour, turmeric and honey mask. Apply for 10 to 15 minutes, then rinse with cold water. Gram flour acts as a gentle exfoliant, effectively removing dead skin cells and unclogging pores, which can help prevent acne and blackheads. It's rich in antioxidants. Gram flour protects the skin from free radical damage and premature aging. Honey is antibacterial and hydrating. Plus, it helps fade post-acne marks naturally. Now, your moisturizer doesn't have to be anything fancy. We make wudu at least 5 times a day. A few drops of rosehip oil or jojoba oil on damp skin is plenty. Rosehip helps fade scars and has natural vitamin A, which is a gentler cousin of retinol. Jojoba mimics your skin's natural sebum, so it hydrates without clogging pores. Less is more, especially when your skin is reacting to hormonal shifts. To recap, keep yourself hydrated. Clear skin starts with water. Eat anti-inflammatory foods, turmeric, ginger, green tea, fresh fruits and vegetables. Cut out dairy. Try going dairy-free for just 3 weeks. For many, that's all it takes to see big results. Reduce sugar and refined carbs because these can trigger hormonal breakouts. Add omega-3s to your diet. Think of flaxseed, walnuts, or a good fish oil supplement. Get good sleep. Your skin heals while you rest. Don't skip it. Now, if you are experiencing acne, it's likely that you may be having other symptoms of perimenopause, like weight gain, period problems, hot flushes, etc. If that is so, I have something for you. But before that, share your thoughts in the comments and don't forget to to like, share and subscribe for more discussions on women's health during perimenopause and menopause from a mainstream medicine, holistic and Islamic perspective. If you are experiencing different symptoms of perimenopause, I have created a playlist of the most common symptoms of perimenopause and actionable tips to help with them. Do check them out. Jazakumullahu khairan for watching, and inshallah I will see you in the next video. And remember, your best is yet to come.